All right, so like Dr. James said, I'm Marissa Cantu. I'm currently a second-year combined child abuse pediatric and pediatric emergency medicine fellow at St. Louis Children's. And today I'm talking about my fellow project, which was evaluating the Missouri Safe Care Referral Program. All right, so as I'm sure everyone here in the room knows, children less than one have the highest rate of victimization for child maltreatment, and 3/4 of all child fatalities were in children less than 3 years of age. In an effort to reduce child fatalities in Missouri, specifically in young children who we know are most vulnerable, House Bill 1877 was passed in June of 2016. What this requires is that in children 3 years and younger who are investigated for abuse by Children's Division, the state's CPS agency, they have to have a screening form reviewed by Child Abuse Resource Center of the Safe Care Network to determine whether or not they need further medical evaluation. Missouri's CPS agency is called Children's Division, and the Missouri Safe Care Network was established to improve the medical response to child maltreatment in Missouri, and it acts to provide training and support for medical providers in the area of child maltreatment diagnostics. Currently, there are 3 child abuse resource centers in Missouri. There's Children's Mercy in Kansas City, Cardinal Glennon, and St. Louis Children's Hospital in St. Louis. And each site takes turn rotating days where they review referral forms that are sent to them. And this process will likely be changing soon as we're moving towards a more regionalized approach. So in accordance with the bill, a safe care provider evaluation referral, which you can see here, should be completed for every child 3 and under who has a hotline report made and is being investigated for abuse. The forms are completed by the Children's Division worker and are submitted to one of those resource centers. On average, the centers are seeing about 600 referrals a month. So once the referral is submitted, the physician at one of these centers reviews the referral and has usually about a day to respond with their recommendations. That can include no further evaluation or a medical exam by a variety of different mechanisms. So the specific aims of my project were, 1, to look at Children's Division compliance with completion of the referral forms, 2, to look at the types of recommendations made by medical providers by the type of abuse and age, and then also to evaluate the timeliness in which the referrals are made. So this was done by collecting data from February, July, and September of 2017 to try to allow some time for the new policy and procedures to be adapted by the agencies and the medical providers. And this was then compared to data directly from Children's Division regarding the numbers of investigations per county during the study months. The data that was collected from the forms included the initial hotline report date, the incident number, the date of the referral that was sent to the physician, the alleged perpetrator's relationship to the child, and then the category of abuse that the allegations had involved. And this was all filled out by the worker. We also collected data regarding whether or not the child had an injury and whether or not the child had already received medical attention for those allegations. And then we also included the recommendations that were made by the physician regarding what further medical evaluation they had recommended. As far as some initial results, when looking at compliance specifically, there were 1,540 total forms submitted. There were 2,077 total Children's Division investigations. So the total compliance that we have for this was 74%. As far as timeliness goes, this is just a chart that shows the average number of days between the report and the referral for the 10 largest counties in Missouri. And as you can see, this ranges anywhere from 9 days to 55 days. The longest average for one county was 95 days in between the report and the referral. One thing we looked at was the presence of injury and medical attention prior to the recommendations that were made. So only about 30% of the children reviewed had received any medical attention prior to the report being submitted. That means that about 23% who had an injury present had not received any medical attention for their injuries. Overall, no further medical recommendation was recommended, or medical evaluation was recommended for about 80% of referrals. An exam by a safe care provider was recommended for 9%, a medical exam by a child abuse pediatrician was recommended for 3%, and 4% had case review recommended. We also looked at the association between the type of abuse and what the physician recommendations were. And there was a statistically significant association between both physical abuse and neglect and the physician's recommendations. There was no statistically significant association between either sexual abuse or emotional abuse. We also looked at the presence of injury and the recommendations as well. And there was a statistically significant association between the presence of injury and the physician recommendations for further evaluation. We also analyzed the child's age and physician recommendations and found that there was a statistically significant association between age and recommendation of medical exam by a child abuse pediatrician, with younger children being more likely to have had this recommendation made. So overall, the results that we saw, we had 74% compliance. About 18% of all referrals had further medical evaluation recommended. Only about 30% of the children reviewed had already received medical attention, and we did have a significant association between neglect, physical abuse, the presence of injuries, and recommendations. We'd like to, in the future, look at more patient-related outcomes, looking at things like substantiation rates before and after the referral process was started, and then also continue to work on process improvement, including surveying children's division workers to get more of their input on the process as well. Thank you.